CPC-COMONAL from 12E Group 18, and in this video, I'll be doing a return demonstration of child cardiopulmonary resuscitation, child CPR. So here we will be doing CPR to victims that age ranges from 1 year old to puberty, and that is actually also according and recognized by the American Heart Association, AHA, that anyone ages from 1 year old of age to puberty are considered as a child. So we will be able to know, or our indicators for us to be able to know that we have a victim or our victim is in puberty or already reached puberty if when chest or underarm hair on males are observed or are visible, and also if there's any breast development on females. So if we are able to see and observe that to our victim, then now we know what kind of CPR, the child CPR, is what we're going to apply to them. Okay, now that I know who and all about the victim that I'm going to do, now I'm going to go to start my return demonstration. Okay, now as if I am now in the scene. No, I have seen a girl collapse on the ground unconscious. Oh no. But first thing that we're going to do is to check the scene. Is the scene safe for us to get through, to get to the victim? So that is the first thing that we're going to do. Check the scene safety. No, because we don't want to put ourselves in danger too. No, we don't want to add up, to be also rescued later. So we want to make sure that the area is safe for us to get to the victim. Okay, and if we are also knowledgeable that there are a pandemic going on or any communicable diseases going on or present nationwide or in our community, then we are going to don our personal protective equipment or PPE. And also if we have observed in the scene that there is a exposure of hazards going on, then we need to don our PPE. As you can see, I also already worn one right now. I also done my gloves, the gown, the PPE gown, but I won't be putting on my mask for now, for the sake of this video, for this demonstration, for you all to clearly see my face and my mouth as I speak. And I won't be also putting on the hood of my PPE gown for you to clearly see my face as I speak. Okay, so now that I put on my PPE, completely put on my PPE, if there is any risk present, as what I have said earlier, if there is an exposure of hazards going on. Okay, after we have confirmed that, we are done now with the PPE, and after we have confirmed that the scene is safety for us to get through, now we are good to go. Ma'am, are you okay? Ma'am, okay lang ka? Ma'am, okay lang ka? Gang, okay lang ka? Okay, as what you have seen, as soon as I have arrived to my victim, what I'm actually doing is I'm checking the responsiveness of the victim. Now by tapping both of her shoulders, as what you have observed earlier, and calling out her name to both of her ears. Okay, because what we are actually want to see here is for her to respond to what we are doing, for her to wake up. And that is what we are doing here. The consciousness check, if the victim is conscious. Okay, now I'm going to run through with that. Gang, okay lang ka, gang? Okay lang ka? Ma'am, are you okay? Okay, if there is no response from the person or from the victim, then that is our cue to proceed, to ask help and to activate the emergency response system. Okay. Ma'am, okay lang ka, ma'am? Tabang, help! Call 911 and nearest hospital here now. Okay, and if we are in a hospital setting, we're going to call blue. Okay, code blue, because that means that there is someone requires resuscitation immediately. Okay, now that we have done that, then now I'm going to proceed in clearing the airway of the victim by tilting her head up or backward. That clears her airway. And also this is the time that we're going to be checking for her breathing. What we are going to look for here, if there is a rise and fall of her chest, because that indicates breathing, that someone is breathing, or that indicates respiration. And also then we're going to check for circulation. So we're going to check for the pulse of the victim. In checking the pulse, we have to be using the hand that is nearest to the victim. Okay, now I'm going to demonstrate that. Once I have done calling for help, clearing the airway, checking for breathing, and feeling for her pulse. Okay, as what you have observed, while doing those three, I am doing that as fast as I can, because actually we are doing the clearing of airway, checking the breathing and the circulation for just up to 10 seconds, no, not exceeding 10 seconds. That's why. Okay, and now if we have confirmed or we have observed that that there is no signs of circulation, means there is no breathing, no pulse at all, then that is our cue to proceed to CPR. Okay, now I'm going to run through that again. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, as what you have observed, while I am doing the CPR, no, or the chest compressions, I am using one hand, no? I am using one of my hand, and I have placed my hand on the center of her, of course, of her chest, halfway through her sternum, okay? That is actually the hand placement here in the child CPR. Okay, so since now I have a child victim that with small breast or flat chested, then we're just going to actually locate for her nipple line, and we're going to be at the center of that, and we're going to go down 2 centimeters, then that is our area of compression. And if we have actually a victim that has a great cup size, no, or is gifted, then we're going to actually locate for her koto-koto or xiphoid process, and we're going to go up 2 centimeters, and that is our area of compression. And if we won't actually be able to locate for her koto-koto, no, if we have like an endomorph victim, that means that we have a massive victim, no, or fat that we can actually easily locate for her koto-koto, then we have to actually locate her last rib, then trace that until we reach the tip of the sternum. Then we're going to go up 2 centimeters, then that is our area of compression. So that's why I have placed my hand earlier, and here I am following just the nipple line and go down 2 centimeters, and that is my area of compression. Okay, and also here in the child CPR, as what you have observed of what I have done earlier, is that here we are actually adequately to give a 100 to 120 compressions in a minute. So that's why, as what you have observed, my counting is 1, 2, 3, no? Because every second I have done 2 compressions only, no, within the 50 seconds. So that means within 15 seconds I have already done 2 compressions. 30 compressions. I mean, every second 2 compressions. So I have done 30 compressions in 15 seconds. To fill in, no, for us to be able to aim that 100 to 120 compressions in a minute. That's why I have actually completed 4 cycles, as what you have seen earlier, 30, 30, that is 60, and plus other 60, that is 120 compressions. And after that, yes, and also as what you have observed while I am doing the chest compressions, I have press down at least here in child CPR, we're going to press down at least 2 inches, and that is at least 5 centimeters, okay? So that's why. And also here, we have to be, in each of our compression, now we have to allow complete chest recoil, no? So if we compressed, we must allow complete chest recoil. That means we have to allow that the chest will go back to its normal shape. Okay, and I know that it can be observed also as what I have done earlier. And also we have to avoid we have to actually avoid over excessive ventilation. As what we have observed, I am giving only, we are going to provide only here 2 ventilation in every set or cycle of 30 compressions. That's why we are using here the 30:2 compression ventilation ratio. Okay, so we're just going to continue our CPR to our victim. Okay, so I'm going to do that so that you can actually observe well what I am doing. And actually, we are continuing the CPR to our victim. Now, if we know that her breathing is not yet doing fine, so or not yet been recovered, so we're going to continue the CPR again. Okay, so let's go. We're going to give the CPR again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, and also as you have observed, in doing the CPR, we are actually using our body weight and not our arms. So using our body weight. Okay, and okay, now if after the 5 cycles of 30 to compressions, compression ventilation ratio, that is after 5 cycles, so that means we have already gone 2 minutes already. So that just means we have aimed the 100 to 120 compressions in a minute. So we have reached that already. Then we have to evaluate or check for the pulse now. Again, check the pulse and the breathing, because we have done our CPR, so we have to check if the victim's respiration is now in good condition now. Okay, so after the compression, we're going to check her pulse and her breathing. Okay, so I'm going to check the rise and fall of her chest and pulse. Okay, and we are doing that not exceeding again 10 seconds. Now, checking the breathing and the pulse. So we're just going to actually check that 5 to 10 seconds. Okay, so after that, if the ROSC or the return of spontaneous circulation is not achieved or is not yet achieved, then we're going to continue our CPR. Okay, if we have observed that there is still no pulse and no breathing, then we're going to continue the CPR again. Okay, I'm going to redo the evaluation of the pulse and the breathing. Okay, there's no breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, now we're going to, of course, be monitoring or evaluating the pulse and the respiration of the victim, because we want to see that she regained her breathing and her pulse to go up. Okay, there you go, gang. Okay, now once the return of spontaneous circulation is achieved, then now I am good to go to position our victim to recovery position. Okay, and that is the recovery position. So now I am going to documentation. I'm going to document the time that the procedure is started, and also the time that the recovery of the victim. And that is my return demonstration of child CPR. Dito ka minutes pa.